Since 13 May 2022, cases of monkeypox have been reported to from 12 member states that are not endemic for monkeypox virus across 3 EU regions. Epidemiological investigations are ongoing, however, reported cases thus far have no established travel links to endemic areas. Based on currently available information, cases have mainly but not exclusively been identified amongst men who have sex with men MSM seeking care in primary care and sexual health clinics. The objective of this disease outbreak news is to raise awareness, inform readiness and response efforts, and provide technical guidance for immediate recommended actions. The situation is evolving, and who expects there will be more cases of monkeypox identified as surveillance expands in non-endemic countries. Immediate actions focus on informing those who may be most at risk for monkeypox infection with accurate information in order to stop further spread. Current available evidence suggests that those who are most at risk are those who have had a close physical contact with someone with monkeypox while they are symptomatic. WHO is also working to provide guidance to protect frontline health care providers and other health workers who may be at risk, such as cleaners. WHO will be providing more technical recommendations in the coming days. Since 13 May 2022, cases of monkeypox have been reported to WHO from 12 member states that are not endemic for monkeypox virus across 3 EU regions. Epidemiological investigations are ongoing, however, reported cases thus far have no established travel links to endemic areas. Based on currently available information, cases have mainly but not exclusively been identified amongst men who have sex with men MSM seeking care in primary care and sexual health clinics. Description of the outbreak: as of 21 May at 13:00 a.m., 92 laboratory-confirmed cases and 28 suspected cases of monkeypox with investigations ongoing have been reported to WHO from 12 member states that are not endemic for monkeypox virus across 3 EU regions. Table 1, Figure 1. No associated deaths have been reported to date. Reported cases thus far have no established travel links to an endemic area. Based on currently available information, cases have mainly but not exclusively been identified amongst men who have sex with men MSM seeking care in primary care and sexual health clinics. To date, all cases whose samples were confirmed by PCR have been identified as being infected with the West African clade. Genome sequence from a swab sample from a confirmed case in Portugal indicated a close match of the monkeypox virus causing the current outbreak to exported cases from Nigeria to the United Kingdom, Israel and Singapore in 2018 and 2019. Countries should be on the alert for signals related to patients presenting with an atypical rash that progresses in sequential stages: macules, papules, vesicles, pustules, scabs, at the same stage of development over all affected areas of the body that may be associated with fever, enlarged lymph nodes, back pain, and muscle aches. These individuals may present to various community and healthcare settings, including but not limited to primary care, fever clinics, sexual health services, infectious disease units, obstetrics and gynecology, urology, emergency departments, and dermatology clinics. Increasing awareness among potentially affected communities, as well as health care providers and laboratory workers, is essential for identifying and preventing further secondary cases and effective management of the current outbreak. Considerations related to clinical management and infection prevention and control in health care settings. Health workers caring for patients with suspected or confirmed monkeypox should implement standard, contact, and droplet precautions. These precautions are applicable in any health facility, including outpatient services and hospitals. Standard precautions include strict adherence to hand hygiene, appropriate handling of contaminated medical equipment, laundry, waste and cleaning and disinfection of environmental surfaces. Prompt isolation of suspected or confirmed cases in a single room with adequate ventilation, dedicated bathroom and staff is recommended.